Before irrigating the NG tube, I would verify my medical order or facility policy regarding type of irrigation, the solution, and the amount. Next, I would gather all my equipment, perform hand hygiene, identify my patient with two means, explain the procedure, provide for privacy, and then I'll put on my gloves. And before I do anything, I'm going to check for tube placement using a chest x-ray, observing for signs of respiratory distress, or checking the pH. And next, I'm going to clamp my NG tube and instill 30 milliliters of normal saline. And then I'm going to immediately draw back all of the contents and clamp the tube. And I'm going to set that aside. And next I'm going to inject air into the blue vent. Position above the stomach. Then I'm going to reconnect the NG tube to drainage or cap it or suction. And then I'm going to remove my gloves and I would assist the patient to a position of comfort. And then I'm going to assess and measure all of the return I got. And then I'm going to perform hand hygiene, do a full abdominal assessment, and document the procedure. And next, for gavage, I would position the client in a 30 to 45 degree angle, and I would verify the placement of the tube using the pH, the x-ray, or the respiratory distress. I would assess the gastric residual and instill the prescribed feeding and then flush with water. And then I would clamp the tube appropriately and document. Next, if I were to receive an order to remove the tube, I would verify the order, perform hand hygiene, identify my patient with two means, explain the procedure, and assess the abdomen, a full abdominal assessment. I would position my client 30 to 45 degrees, do hand hygiene, and put on my gloves. And then I would turn off suction or disconnect the NG tube from suction or drainage. And then I'm going to irrigate my NG tube with 20 mLs of air. And then I would instruct my patient to take a deep breath and hold. And then I would clamp the tubing and quickly and smoothly remove the tubing. And then I would dispose of all my equipment and I would provide oral and nasal care. And then I would remove and discard my gloves, perform hand hygiene, and document my procedure.